guys, this is Lucy here. So today we're going to look at the condition in medicine, and the main topic of discussion we're going to look at today is bladder cancer. Well, before we go any further, I'm first going to outline some of the things we're going to look at today. The first thing that we're going to do is we're going to list the features of the urinary system. We're going to define bladder cancer. We're going to talk about the types of bladder cancer, the predisposing factors of bladder cancer. We're going to talk about the stages of bladder cancer and also how you can diagnose a person with bladder cancer. So let us begin. I'm just going to list down so that we can at least have a recap on the urinary system, like the features that are or those structures that are composed in the urinary system. So the first thing we have that we have to know about the kidneys, the ureter, the bladder, the urethra. So these are the major features that we need to know under the urinary system. So the definition of bladder cancer. This is just the abnormal growth of the inner cells of the bladder, which are called the urothelium cells or the transitional epithelium cells. Yeah. So I'll just simply elaborate a bit on the definition. Like the major keys you're supposed to put there is that these are abnormal urothelium cells. The urothelium cells are also known as the transitional epithelium cells. Yes, which can either be cancerous or non-cancerous. By cancerous, we mean these are malignant, which means it can spread. It can spread to all parts of the body by mode of transfer such as homogeneous, lymphogenous, and also direct and contacts. That's what we mean by cancerous and also malignant. When we talk about benign, which means this type of abnormal growth cannot spread. Yes, it can't spread and it doesn't really bring harm. So that's the definition of the bladder cancer. We're now going to talk about some of the predisposing factors of this particular type of cancer. Since we all know all types of cancers, we don't really have it's idiopathic. We don't really know the major cause of cancer, so we only have predisposing factors. And some of the predisposing factors that we have, it can come about due to certain birth defects on the urinary tract, and the other cause can be smoking, alcohol, certain drugs. Maybe you already have a different type of cancer, then you are on chemotherapy. As the detoxified drugs are being excreted from your body, they can also lead to an alteration of cells in the urinary system, which can also predispose you to have bladder cancer. So these are the major predisposing factors that we have that can result to bladder cancer. Yes. We're now going to talk about the clinical features of bladder cancer. So some of the clinical features that we have frequent need to urinate, like frequent need to maturate, like you want to urinate frequently and everything like that. And also passing blood in urine, which can also be an indicator to a different type of condition. That's why you have to make sure when you have blood in your urine, you have to make sure you go to the hospital so that you can have a urine test to check if everything is fine. Yes. The other thing that you also have, you're going to experience pain when passing urine. And then the other clinical feature that this particular person is going to present with is you might want to pass urine, but there isn't nothing that is coming out there. So those are the major clinical features that this particular person can present with. But always remember, these clinical features can also represent a different condition, underlying condition that is happening to this particular person. Yes. I'm then going to talk about the types of cancer that this person may present with. Quite right, this person can come with bladder cancer, but which type of cells are being affected in this particular person? So The first one that this person can have urothelium cells carcinoma or transitional epithelium carcinoma. That's the type of cancer this particular person can present with. And this type of cancer, it originates inside the bladder and in the underlying cells that are found inside the bladder. And then the other type of cancer this particular person can present with is the squamous carcinoma. This is the type of cancer that this person is going to present with. The last one is the glandular cell carcinoma, which means it's going to affect the glandular cells. Yes. And then we're going to now talk about the stages of cancer. We actually have 5, but that's how I try to remember it, but they are staged as stage 0, stage 1, stage 2, stage 3, and stage 4. So stage 0, this is when the cancer is now in situ. It's in situ. The cancer is in situ. Stage 2, it is when the cancer is now going deep in the cells. It's going deep in the cells. And then this at stage 2, this is the best time when you can have surgery. That's when surgical interventions are supposed to occur. Stage 3, this is the stage where the cancer has now gone to the muscle. It's affecting the muscle. It's affecting the bladder itself. So when you go to stage 3, this is when the cancer has now spread to nearby organs, such as the uterus, if it's in the female, such as the uterus, the rectum. Such organs are now being affected. Stage 4, this is the full-blown cancer, when the cancer has spread to all parts of the body, through the lymph, through the blood. It has gone to the liver, the lungs. So this type of cancer, the stage 4, it's the one where we mostly just give palliative care, where you just help them allay the pain, allay anxiety and also relieve the pain, but there's nothing that can be done at that particular stage. We're now going to look at how you can diagnose this person with bladder cancer. So we've got 3 major investigations or diagnosis that you're supposed to apply to this particular person. So what you're supposed to do first is that you need to do a urine test. That's the first thing you're supposed to do. You're also supposed to do a cystoscopy. That's what you're supposed to do. And then you also have to do biopsy. By biopsy, you take out tissue from that site, from the bladder, then it's going to be taken for histopathology. Yes, that's what is going to happen. So that's what I have for you today, guys. I hope you've gotten 1 or 2 things, and remember to subscribe to my channel, and don't forget to like and always read further. Have a good day. Take care. I appreciate everyone who subscribed to my channel. Thank you.